next slide we have on this is encephalitis. Okay, what's encephalitis? Actual infection of the brain tissue. The brain tissue. Okay. Basic things as far as our causes, it's going to be almost the same with already infection somewhere. And preventative is to catch it early, look for your signs and symptoms of your fever, increased heart rate, those type of things. In a professional collaborative care, so you'll do the assessment and we'll do drugs. Complications are going to be very similar to like meningitis. Meninges are infected or encephalitis is the brain. Okay, bottom line is they're close enough, you're going to treat them very similarly. Okay, now, I don't have the answers to this, so you guys are going to have to tell me, do you have the answers on your screen to this? Sweet, but let's go through them. Try not to look at the answers until I'm ready for you to tell me the answer. Wife of a patient recently diagnosed with Alzheimer's. Asked the nurse if there's a cure for her husband's illness. So first of all, is there really a cure? No. Okay. What's our best response? A, eating a balanced diet, including lots of soy products, can prevent Alzheimer's. Yeah, well, maybe if they're Chinese. Okay, B. So we're going to do a cholinesterase inhibitor drugs such as donepezil or Aricept can slow the progression of the disease. C, removal of neuritic plaques can prevent vascular degeneration, improve brain cell function, and decreasing the levels of neurotransmitters in the brain can slow the progression of the disease. What do you think? I don't think Chinese. Yep. I also don't think, because the plaques that you see in the brain, we're not going to be able to get those out. That's like, how would you even do that? And decreasing the level of neurotransmitters. No, that's the problem. The neurotransmission is not happening, which is what the problem is. So, B, everybody agree? Aricept will slow the progression. Okay. All right. Who wants to read the next one for me? Nice and loud.
I know.
Thank you.
You're welcome.
Okay, Peyton.
The wife states that her husband is able to perform most of his own ADLs and wants to keep her husband safely and independently functioning in their home as long as possible. To help her husband maintain safe independence, which action should the nurse recommend?
I don't know. I kind of like A because I just don't want to take care of him anymore and let him go out the door, right? Nah. Okay, B. You think crowds of people he's going to function well with?
No.
No. What about the key time to this is, or the key point is varying the times. Do we want to change the schedule at all? Nope. So D, place outfits on hangers. There we go. Allow the patient to choose what to wear. And it makes laundry easier. You just get it out, you just put it all in one hanger. Boom, you're done. You've got that whole set ready. Okay? All right. Next case study. Who wants to read this one? You want me to pick somebody?
I'll do it.
Thank you.
At a 6-month follow-up appointment, the wife states that the patient occasionally has difficulty finding the correct words to use when he is communicating. What term does the nurse use to document this assessment data?
C, I hear. Everybody agree? Wrong words. No words. No words. Not yet. All right, who wants to read this next one?
I'm good.
Okay, Brenda.
At an 18-month follow-up appointment, the wife states that her husband seems depressed most of the time and has become less talkative over the past few months. Which medication could be helpful for this patient's symptoms?
What are your thoughts? What would be the best for this patient? He's very depressed. Okay, I don't have the answer, but I say it's A. A, Zoloft.
Oh, the others, B, C, and D are all tricyclics. Your SSRI, A, is going to be more quick acting, more energizer.
All right. Who's up next?
I can read it.
Thank you.
The patient's wife calls the physician's office to report that she is concerned because the last time her husband took a walk in the neighborhood where they lived for 35 years, he got lost and a neighbor brought him back home. What measures should the nurse recommend for patient safety? Select all that apply.
A, should we do A, enroll him in the safe return program?
Yes.
Okay. Have him wear an ID bracelet or badge at all times?
Yes.
Place him in a jerry chair when you can't be with him.
No.
No, because you don't want him restrained. D, ask your doctor to prescribe a sedative drug to keep him calm. No, not going to help. Take him for a walk 2 or 3 times a day in different neighborhoods. You can do the walk 2 or 3 times a day, just don't do the different neighborhoods. Okay?
And on here it says you should do C as well.
Says you should do C? What are you guys' thoughts on that?
I was thinking restraint too.
It says physical and chemical restraints such as sedatives should only be used as a last resort.
Okay. So we don't try to restrain them
Yeah.
unless, you really, if you think they're going to fall while you just go to the bathroom, if you don't have any other help at home, then I guess you could do that. But I prefer not to use restraints. And in the hospital, we try to do no restraints if at all possible. Okay, and as far as restraints, how often do you have to get a doctor's order?
Every 24 hours.
Every 24 hours. So if you got it at 2 in the morning, when do you have to call the doctor again? 2 in the morning. Or if you're really nice and you're on top of it, you can call them at 10 p.m. at night and say, this is how the patient is. This is what we have. Would you like to write an order if they have not, their behavior has not changed or whatever, the situation has not changed? I would like to continue this order at 2 a.m. They might appreciate your foresight on that, okay? Tends to make them happy. All right. Who wants this one? Okay, thank you.
During the call, the wife states that she must go out of town for 3 days to care for an elderly cousin, and she is concerned about her husband's care. Which nursing response is appropriate?
Really like that. Can't you just come home sooner than 3 days? Ooh, little guilt here. Why are you choosing to care for your cousin instead of your spouse? Your husband only has mild Alzheimer's disease, so staying home alone is acceptable? Not quite. And that word only can really get you in trouble with people very quick, fast, and in a hurry. They would be like, they can take offense to that no matter what the only is about. So be careful with that word. Indeed, there are organizations that may be able to provide an interim caretaker for your husband. Absolutely. And then there's also some daycares. So even just daytime, so you can get your groceries. You can even get your own self-care taken. There's different things that can be done for these people. And to give support to the family. All right. Can I, would you help me to show a video? Let me see if I can get out of here now.
And then we just go back.
Okay, now those, did I get that?
You did. You hit on it, so just use the back. So just go to that. Do that. Just double. Okay. I would just do one.
Okay.
Is that the one you want first?
You know what? Let's do this one. We talked about this earlier.